Hello and welcome. I'm Angela Wright with Wright Wealth Management. So glad you could join us today for our very first virtual workshop. Today we are talking about Medicare. It is currently open enrollment for our seniors, and there are a lot of changes coming to the plan in 2025. So we are here to talk to you about those. I've got my friend Susan Lucas with me today. She is a Medicare specialist, a licensed insurance broker. She educates seniors on Medicare, and she does it really, really well. She's going to tell you today about how she grew up in a multi-generational home with parents working full time, caring for the kids, caring for their parents, and it really fueled a passion to educate the community about healthcare and well-being. Before becoming an insurance broker, Susan was a nationally certified massage and bodywork practitioner, serving adults and retirees. And, in her wellness practice, she used a holistic approach with folks, really tailoring modalities to fit the needs of each person. And she brings that energy into her insurance practice. It's going to be really challenging. So I am going to let the specialist take it away for you today and tell you everything you need to know about the plan itself. If you're new to it, there's some basics here for everybody. And then if you've been in the plan and you're experiencing some of these changes, she'll walk you through what you need to know. Susan, please take it away.
Awesome. Thank you so much, Angela, for inviting me here today. And I'm really looking forward to sharing some of the basics about Medicare with all of you. And hopefully I will address some of the questions that some of you who may be more seasoned Medicare beneficiaries as well. But I'm going to go ahead and bring up my presentation and get started. Okay, does everybody see my screen okay?
You've got it.
All right, perfect. So Angela, you gave a great introduction about my background and history. It is very true. I do come from a background myself in massage therapy. I had a practice for about 12 years and really loved working with my older clients. I could see how much it increased their quality of life. And it was really sad for me when I got to a point in that career that I couldn't do it anymore physically. So I had to make a shift and somehow decided that insurance was a good industry to get into. I floundered for a couple of years and then I found my niche here in Medicare. And I absolutely love working with my clients. They are really special people to me, and I want to help them get the best out of their remaining years as possible and get the health care that they need and will fit their specific budget as well. So just to get through the compliance stuff, I am not an employee of the federal government or the Medicare program. And I also am not an agent for every plan that is available in the area. I currently represent about 5 organizations in Solano County with 14 different products on the Medicare Advantage side. In Contra Costa, I believe that is 4 organizations and 12 products, something like that. If there is a product that I do not represent, your best place to visit is the Medicare.gov website, or you can call them at 1-800-Medicare. And there is also the state SHIP health insurance program where you can get information about all of your options. So now we've taken care of that. And this QR code that you see, if you are technically savvy and you are comfortable with using a QR code, that will give me your basic information and permission to contact you, because I am not allowed as an insurance agent specializing in Medicare to make cold calls to people. So I can't have Angela just say, oh, I want you to call my clients. You have to initiate that contact with me.
This is important. No one's going to reach out to you unless you hit the QR code. And after this, you're probably going to want to.
Right. And you'll have other options throughout the presentation as well. Let's see, how do I make it go forward? There we go. So Angela already mentioned a little bit about my history growing up in a multi-generational home. These are pictures of my family and my grandparents on either side. And it's true, when I was about 7 years old, my mother's parents, which are on the right side of the screen, decided that they wanted to be closer to us. They were already pretty close, to be honest, but they decided they were going to move right next door to where my parents lived, which actually was a lot of fun for me as a kid. When my parents were working, my grandparents were always there. And so I had, my grandmother next door to go have tea parties with after school, and she would let us use the nice china. And my grandfather would give us candy and money, which we always thought was fun. And so it was really just a fun experience, and it gave them the additional support that they wanted, but we were all able to maintain our own independence as two separate family units as well. When my father's parents on the opposite side, excuse me, of the screen, had started having more health issues, their situation was much different. My grandfather, you see with the giant fish there, and I don't know what it is, a bass maybe, but anyway, doesn't matter. He was an avid outdoorsman. He loved fishing and hunting and gardening and everything that had to do with outdoorsmen or being outdoors. And when their health started to fail, they weren't in the same financial, oh shoot, sorry about that.
It's okay. We're all good. I still
Are
see
you
it.
still seeing the
Yep, you're
presentation?
still up.
Okay, my screen just went nuts, sorry.
Oh, the joys of technology.
Okay, there it is. I apologize for that little break. Anyway, my grandparents did not have the same financial situation, so there was not an ability for them to get in-home care or move into a facility where they could have their needs met. So they moved into our household. So that changed the family dynamic significantly. And it was a situation where my parents were both working full-time, trying to raise my daughter or my sister and myself, and taking care of my grandparents as well. So it was challenging in those years, but I, as Angela said, have a great appreciation for families who are in similar situations and helping them to get the support and care that they need for all of the family, for themselves as well as their aging parents. So anyway, let's move into the actual bread and butter of Medicare. So Medicare is for people who are in their older years. You become eligible at age 65, and you have 7 months when you are turning 65 to initiate or start your Medicare A and B, which is what the federal government provides. So the month of your birthday, you want to start 3 months before the month of your birthday when you turn 65. There is one caveat to that. If your birthday is on the first day of the month, you want to start 4 months before the month of your birthday. But otherwise, 3 months before the month of your birthday is when you want to start at least looking into your enrollment in Medicare A and B. If you have already started collecting Social Security benefits at age 62 or before age 65, you will automatically be enrolled in Medicare A and B. But if you have not started your Social Security withdrawal, then you will have to initiate that process by going to the Social Security website at ssa.gov or visiting a local office. You can also call them. Sometimes that works out, sometimes it
Maybe you
doesn't.
have all day to sit on hold.
Yes.
Yeah.
But I recommend for most people that they want to start that process early to avoid any gaps in coverage or late enrollment penalties, which I will be talking about.
Really does take 3 months too, so don't mess around with this.
Yeah, it can absolutely take the full 3 months for Social Security to process that application and have your benefits effective for the first of the month of your birthday. Now, for people who are still working, because I know this is very common for people these days, especially here in California, that they're working well past age 65. As long as you have employer benefits through your own employment or through a spouse's employment, then you can delay your enrollment in Medicare, and specifically in the Medicare Part B, which covers your preventative services and your regular doctor's visits. And then once you have your Medicare in place, then you will have the option to look at enrollment in additional coverage through a Medicare Advantage plan or a prescription drug plan and Medicare supplement insurance. And this is sort of an example of what the Medicare A and B card will look like in a cartoon sort of fashion. Your Medicare Part A is for your inpatient hospital care, and Medicare Part B, as I just mentioned, covers doctor's visits and outpatient care, your preventative services. For most people, as long as you are a U.S. citizen or legal resident and have contributed into Social Security for 10 years or 40 quarters, then Medicare Part A does not have a premium. You essentially prepaid it. Medicare Part B, the current rate for 2024 is $174.70. I do anticipate that will increase in 2025. I have not heard an exact amount, but I anticipate around $185 a month starting in January.
And many folks, dual income folks here in California sort of hit those parentheses, right? Like
yes, they do. So for people who have higher income levels, there is a Medicare, what is it called?
Irma, good old Irma.
I know, Irma, Medicare
income related.
Maybe if I look at it,
it's income related.
Yeah, income related Medicare adjustment amount.
There you go.
That income-related Medicare adjustment amount will apply to Medicare Part B as well as your Medicare Part D. And we'll go into all the other CDs of the Medicare ABCDs in a few minutes. But so currently, the IRMA will apply to couples who have income in 2022 of over $206,000, their Medicare Part B will have a higher monthly rate than the $174.70 that most people pay. And as your income gets higher, that rate does increase. I'm not going to read all through these numbers. It is available if you look it up online.
Yeah. And this is a per person. So as people are budgeting for medical expenses, this is your baseline per person.
Yeah, yes. So this is just a slide that shows some of the benefits that are covered under your inpatient hospital care of Part A. I'm not going to read through this. This is also available on the Medicare.gov website that you can find. And then on the next slide is the Medicare Part B insurance coverage. This is the part that most of your coverage will fall under for your doctor's visits, any visit to a specialty doctor, annual wellness exams, annual vaccinations like your flu shot, COVID, pneumonia, and hepatitis B, and any kinds of lab work, and different tests that you may need for your ongoing health.
I would like to remember this as A for admitted. You're being admitted somewhere.
Oh, that's a great one.
B for booking. You're booking an appointment to go somewhere.
Oh, wow.
It's like not always perfect,
that.
but close. We're getting closer to something that makes sense.
Yes, absolutely. I like that distinction. I'm gonna have to remember that.
Mm.
So as I mentioned, there can be some penalties if you do not enroll in Medicare when they want you to. I don't see Part A penalties very frequently. Generally, this occurs when a person doesn't have the 40 quarters and they decide, well, I'm just not going to get Part A. Medicare doesn't really like that. One of the things that I recommend for people who fall short is get it. If you don't have other coverage, you'll have to pay for it, but get yourself a little part-time job. I've had people work as a greeter at the Walmart just to satisfy those 40
Oh,
quarters
yeah.
so that they could get rid of that Medicare A penalty,
And working
or
1 or 2
not
days a week
penalty,
will satisfy
but
that quarter requirement.
pardon?
It doesn't have to be a full-time employment to satisfy that quarter requirement.
Not necessarily,
Hmm.
no.
Great.
So, I mean, sometimes people are, it's amazing how short they are, but I mean, if you're short even just a little bit, it's like 250 something dollars to get Part A.
Yeah, it's
And
worth
if,
it to go get
yeah,
paid.
so it's worth it to have a little silly part-time job for a little while to get that, to satisfy those 40 quarters so that you don't end up with a lifetime penalty of this 10%. So, and then on the Medicare Part B, it's also 10% for a full 12-month period that they go without Part B. If it's, just a few months, then it's going to be 1% per month of the national average, or the national premium for Part B that they pay as a penalty. And that does go on. I believe it lasts for 2 or 3 years that you have to pay that penalty before it drops off. The Part D penalty is by far the more severe one, and you definitely don't want to have this one. Medicare requires that people have creditable prescription drug coverage. With most of your employer benefits, as long as you haven't received a letter from them saying your plan is not considered for prescription drug specifically, your plan is no longer considered creditable according to Medicare's standard, your employer benefits, if you're working past age 65, will satisfy Medicare's requirement, and you will not have a Part D penalty. Usually the problem is because people say, well, I don't take any medications, so why do I need that?
Yeah.
Unfortunately, Medicare doesn't agree with you. They don't care if you don't take medications. They want you to have a drug
You got to
plan.
split that cost with everybody. Makes sense.
So if you go any longer than 2 months, basically, or 63 days without creditable drug coverage, you will be assessed a 1% penalty of the national average premium for prescription drug plans at that time, each month that you do not have coverage. I've seen people go 10 years without
Ugh.
that.
Oh my gosh. And then you pay that penalty
And
forever.
then you pay that penalty forever. It never goes away. So it's very important that you make sure you have drug coverage to satisfy Medicare's desire for you to be covered.
And I don't know if you're going to get into this, but there are drug plans that are very inexpensive if
I
you're
am
not
going to
taking.
get into some of the drug plans, or I'm not going to talk about specific plans, but I will talk a little bit about the drug plans this year as far as the averages go. So, all right. There are additional enrollment periods, of course. Angela mentioned that right now we are in what is called the annual enrollment period for Medicare. And I don't like that it says Medicare Advantage there in the little orange slot where it says October 15th through December 7th. This applies to both Medicare Advantage and prescription drug coverage predominantly. This time every year is your opportunity to review the benefits that you currently have and see what changes are going to take place with your specific plan for the following year. And if you don't like it, now is the opportunity you have to make a change to a different plan. I do highly suggest that people be looking at their mail, specifically mail from their current insurance coverage. that will include a letter called the Annual Notice of Change. That letter will give you in detail what your benefits are for this current year, 2024, and what those benefits will be for 2025. It will show you if there are rate increases on premiums, on copays or coinsurances, and if there are benefits that are no longer going to be available to you. I want everybody to at least read that document this year. So when January 1st comes, you're not shocked, because there are some significant changes coming for 2025, which I will get to in a little bit.
Read it like the day it arrives, so you have time to make these changes. You know, if you're reading it on December 5th, you're not going to get an appointment with Susan in time to fix this, you know, if you need help.
Yeah.
So please open it now. You should have it in your mailbox.
You should have it by now. A lot of mail seems to have been delayed recently
Great.
because of the storms on the East Coast.
Yeah.
But most of my clients have received these notifications by now. So check all the mail that you've received recently to make sure that first of all, your plan is continuing for next year, because there have been a lot of plan terminations for next year, and to make sure that you're not completely dissatisfied with if there are increases, like I said, in premiums or copays for next year as well. In addition to this annual enrollment period that is every fall, there is an open enrollment period in the first quarter of the year, specifically for those of you who are on a Medicare Advantage plan. So this is a opportunity from January 1st through March 31st for anybody who either was not able to make a change to their Medicare Advantage during the fall enrollment period, or they did, but then they find come January, February, as they start to use the plan, that they don't like it or it's not working for them. You have a one-time opportunity in this first quarter to change to a different Medicare Advantage plan or return to original Medicare with prescription drug coverage. And then throughout the year, you can qualify for a special enrollment period, generally based on some kind of life-changing event or trigger. Losing your employer health coverage or retirement will give you a special enrollment period that you can take advantage of when that happens throughout the year. If you move, whether you're moving across a state border or even just a county border, in some cases that may require that you need to reevaluate your coverage and make sure that you're still going to be able to continue with that plan in your new location. Changes for people who may have Medi-Cal or extra help status, they also will get special enrollment periods. And then in certain areas, if you are diagnosed with a specific disability or chronic health condition, you may qualify for a special enrollment period as well. So as an insurance agent specializing in Medicare, I do offer no-cost consultations to anybody who would like to talk to me about their specific needs. I will help you review your plan benefits and costs, navigate the right plans for your specific needs, and that includes your healthcare needs as well as your budgetary needs. Help you find providers that are in your network, which can be challenging these days. So I will assist in getting you some help finding a provider that is accepting patients, resolving problems. I hate that I have to say this, but unfortunately, problems do come up, billing problems in particular. And it is important that you don't just, well, get mad or pay a bill when you're not clear about what the bill is for. I have had recently a couple of my clients contact me with bills that when we looked into it, we found out they were fraudulent. The insurance company The doctor had submitted it appropriately. The insurance companies had already taken care of it and it had been paid, but they had still received a bill, whether that was because of a late, I don't know, billing cycle, I don't know. But what we found out was that they didn't owe anything. And if they had paid that bill, they could have been out a significant sum of money.
Ugh.
So anything like that, please contact me. I also want to help you make sure that you're using all of the benefits that are available in your plan, because there are some benefits that are there just to kind of make your life easier and simpler. But if you don't know about them, then they're not helping either you, and it is costing the company who provides your plan more money than it's worth for them to invest in that service. Looking for additional resources. So like my connection with Angela, I have a lot of other professionals that I work with. So when things are coming up in your life, I can often refer you to somebody else who is qualified to assist in certain areas. So please reach out when there are changes happening with yourself, your health, and whatever other needs you may have. And again, this is that QR code if you'd like to scan that and have me reach out to you. Okay, so I showed the Medicare A and B previously, which is what the federal government provides. And I didn't specifically say this then, but it said it on the slide. Medicare A and B does cover approximately 80% of your healthcare costs. But then there's that 20% that maybe you don't want to have to pay completely out of pocket. So there are some additional coverage options to make up that 20%, or at least help cover portions of that 20%. The first option is the Medicare Supplement Insurance Plan, which is more of a traditional insurance, plus a standalone prescription drug plan. And then the other option is the Medicare Advantage Plan, also called a Medicare Part C for combined plan, which combines your Medicare A, B, and Part D for prescription drug coverage into one package for you. And now I'm going to go into some details about how all of these different types of plans work and the options you have available. So the first one I'm going to cover is the Medicare Advantage or Part C combined plan. This can be considered an alternative to Medicare A and B. You still have to have Medicare A and B to enroll in a Medicare Advantage plan, which means you have to continue to pay that Part B premium. But when you become a member of an Advantage plan, the carrier who provides that plan is the administrator of all of your health benefits. So everything would go through that company, whichever company it happens to be, that is providing the Medicare Advantage plan. And all of these companies that provide these Medicare Advantage are private insurance companies that have contracts with Medicare to provide these services. And these plans are approved every year by Medicare. So the companies start submitting their plans for the following year in like February or in March, early in the year. And they go through this approval process starting in April through, I mean, it can actually go all the way through the end of September before Medicare finalizes, yep, we agree these benefits are okay, and you can put this on the market.
Marcy, for
There
the
are
popular ones around here, people sometimes have a hard time kind of like wrapping their minds around the difference. And a lot of my folks on Advantage are with Kaiser. And I would say, I don't know if in your opinion, if that's the most popular one, but that's the one I see the most in the area. So it's just kind of like classic kind of Kaiser, everything under one roof is a good example of how Medicare Advantage works. Would you say?
That is correct. So Kaiser is the number one, or I shouldn't say number, I don't mean number
Biggest?
one like they're the best. I
The
mean like
biggest.
number one, like they were the first people in California to offer the Medicare Advantage program. And they are a traditional HMO, which stands for Health Maintenance Organization. So Kaiser kind of started this whole Medicare Advantage business, and then all the other insurance companies have followed suit. And Kaiser is nice because it's convenient. When you're a member of Kaiser, you know exactly where you're going to go for pretty much all of your appointments, for, everything. The other HMOs that are available in the area will be tied to different medical networks. So would be like John Muir has plans that are specific to John Muir, that in the Medicare Advantage area. Sutter will have plans that are specific to Sutter. But with an HMO, you have to use their medical network, which usually is whatever is in that entire medical group. So if the medical network is John Muir, as long as you stay within John Muir's list of providers and the locations for John Muir, then your benefits will be covered. The other type of Medicare Advantage plan that we have in this area is the PPO, which is a preferred provider organization. And those work differently. They still have a network of providers, but instead of contracting with a whole medical group, they contract with individual doctors and specialists and providers. So you'll want to, as much as possible, use in-network providers, whether you're on an HMO or a PPO. The big difference is that on a PPO, you do have the option to use out-of-network providers as long as they agree to accept your plan. And you will pay a higher copay or coinsurance for those out-of-network services. On an HMO, that is not an option. You will pay full price for whatever service you get out of network on an HMO, where the PPO, you'll have a copay or coinsurance you'll be responsible for. So that is an important distinction between the two. And then some of the things that people like about the Medicare Advantage plans in particular, well, one, it includes prescription drug coverage. So you don't have to have another separate drug plan. It's all included in your Medicare Advantage program. The other couple of services that are included are vision and hearing, and you'll often get benefits to help pay for hearing aids if you need hearing aids, or also your eyewear if you need eyewear. And then there are some plans that are covering some dental. Dental is still kind of not covered as well as I think it should be in most cases, but there are some plans that will have some dental coverage as well. And those benefits, vision, hearing, and dental, are not covered at all by original Medicare or the Medicare supplement plans. The only option on the Medicare supplement for the dental, vision, and hearing would be if they have it as an additional rider that you would pay more for on that plan.
What's so funny about this too is like our eyes and our teeth and our ears are like the first things to go for all of us. And it's the one that's not covered, come on.
I know, it's kind of crazy.
Why do they do this to us?
Especially the teeth.
Yeah.
In particular, they've found out so much more about your oral health being very important for your overall heart health as well. So I think it's a problem of Medicare not being able to get it through Congress and everybody to vote yes to add dental as a covered service through Medicare.
Yeah.
So anyway.
Yeah, that's another podcast.
Maybe that'll come sometime in the future, but I don't know. All right, so I want to talk about the drug coverage. And this is an area next year that there are significant changes to due to the Inflation Reduction Act that was passed 2 years ago by Biden. There are currently 2 ways you can get prescription drug coverage. One is through a standalone drug plan, or Part D is what they call it, plan. And then the other is with a Medicare Advantage plan that includes the prescription drug coverage. And again, these are all offered by private insurance companies. The drug coverage, whether it is through a standalone plan or a Medicare Advantage plan, is administered exactly the same. So all of what I'm going to show you applies to either type of benefit, standalone or Medicare Advantage for your drug coverage. And these are also highly regulated by Medicare. So the drug plans have to meet Medicare's standards in order for them to be available in the marketplace. But there's a lot of things that make drug coverage in particular very confusing. The first thing that you should be aware of when you're evaluating your drug plan is their pharmacy network. Not all plans will accept that you use any pharmacy you want. I was speaking with a woman yesterday. She's like, I want to use Costco. I'm like, well, unfortunately, this plan doesn't allow you to use Costco. Let's see what other pharmacies are nearby for you that you would be willing to use. But in general, you want to try to use the preferred or mail order pharmacy that is available through that plan. That's going to give you the lowest cost. If you use a standard pharmacy, you will still be able to use that pharmacy as long as it is listed as a standard pharmacy that drug plan accepts. But the cost for your prescriptions could potentially be a little bit higher at the standard pharmacy than through the preferred or mail order pharmacy. The next thing, and this is really the big one, I think, is the formulary for the prescription plan, which is also the drug list of covered medications. You want to make sure that your medications are covered by the plan. One reason is because if they aren't covered by the plan, what I'm going to show you next about coverage limits for the year would not apply. Those medications will not be included in those out-of-pocket costs if they're not covered. There are ways to get medications that aren't covered, or at least ask for medications that aren't covered to be covered by your plan. It does require that you work with your doctor, whoever prescribed that medication to you, and the insurance carrier to get that. They call it a formulary exception, but it is available for those circumstances where maybe you need a medication that is not on the formulary. The next thing to be aware of is that the formulary is organized by tiers based on the cost of medications. So in general, you just want to remember that a tier 1 are going to be the least expensive medications, and then the higher the tier number, the more expensive that medication will get. I don't think I need to say more about that, but if anybody has questions, certainly reach out to me.
I think just only to check, because you would be really surprised, a very standard drug that was covered on your last plan just suddenly isn't, or it's not at that milligram, but at 2 milligrams different, it is covered. So
yeah,
you actually have to go look at this.
It really is
So
important. And another thing I'll note, because this comes up often, is people are like, well, I get that covered 100% this year. Unfortunately, this year and next year are not the same.
Yeah.
Just because a medication is tier 1 this year and it doesn't cost you anything does not mean necessarily that it's going to be tier 1 next year and not cost you anything, or that it's even going to be covered in some cases.
And here's maybe why. Tell us about the changes.
So as I mentioned, the Inflation Reduction Act has changed drug coverage completely for 2025. There is a new $2,000 maximum out of pocket for all of your covered prescriptions on either a standalone Part D plan or your Medicare Advantage plan. So you won't spend more than $2,000 on your medications, but they have to be on the formulary, or you have to have gotten that formulary exception if it wasn't, for it to count towards the $2,000. The next thing that they're introducing is a Medicare prescription payment program for those people who may have a very expensive prescription medication that is just a little bit too much for them to pay for 100% out of pocket at the beginning of the year when they first refill their medications. This program is administered by the insurance carrier that you have for your prescription drug plan. So if that's something you're interested in, you should reach out to them early in the year, or even maybe, late in December, once you know what your benefits are going to be for January 1st, to inquire about that program and how you would enroll to take advantage of that. And then the last thing that is taking place for 2025 is the elimination of the coverage gap, which means no more donut hole. Yay. Yes, this is fantastic news for everybody, especially people who have some very high cost medications or many medications that they're taking for their health needs. So what does this look like? So I have a graph of what it looks like here on the left-hand side of the screen for 2024, where there are the 4 stages for prescription drug coverage that are going to continue through the end of this year, starting with the deductible, then your initial coverage phase, the donut hole that still exists for the rest of this year, and then the catastrophic phase. I'm not going to talk too much about that because I want to talk more about what's happening in 2025. In 2025, you'll notice there are only 3 stages for drug coverage moving forward. There is still going to be a deductible. The highest the deductible can be next year is $590. That does not mean that your plan will have a $590 deductible necessarily. The standalone drug plans more commonly will have the full $590, but on the Medicare Advantage plans, it's usually much less than that. But if your plan has a deductible, whatever that number is, you do have to pay that 100% at the beginning of the year when you first fill your prescriptions before your medications are covered. Then you will enter the initial coverage phase. You pay the copay or coinsurance for your medications that are covered up to the $2,000 maximum out of pocket for next year. And then if you do get to $2,000, which many people don't, so this doesn't apply to everybody, but those who do hit that $2,000 maximum, you will enter catastrophic coverage for the remainder of the calendar year, and your medications are completely covered by your insurance carrier. One thing that you may have noticed, and I want to make note of, is that the coverage, maximum out of coverage limit this year is $8,000, and next year that is $2,000. That $6,000 gap is a big deal, not to you. It's beneficial to you, but the insurance carrier has now become responsible for most of that amount. There are some portions that Medicare picks up and some portions that even some of the drug manufacturers will pick up. But most of that $6,000 is now the responsibility of your insurance company. And they're a little bit scared about what is going to happen.
Yeah.
So unfortunately, I have seen, as a trickle-down effect of the Inflation Reduction Act, that the Medicare prescription drug premiums for next year, especially on the standalone plans, have increased significantly.
Well, surprise, a for-profit company is going to pass the cost along to you. Woo.
Yeah.
It's really unfortunate.
So it is unfortunate. However, there are still a couple of low-cost drug plans available on the marketplace. There's one that I am finding has a very good formulary and good coverage for most of the clients that I have on standalone drug plans. That's right around $20. But most of the other plans are in the high 90s or over $100 a month for just the premium. In some cases, those plans that are higher cost may be the appropriate plan for your needs. So it still is dependent on whether your medications are covered by the formulary and, what medications you're taking that we need to make sure are going to be covered for next year. So it's very important for people with drug coverage, which is everybody on Medicare, or at least it should be, to review your benefits this year, whether it's a standalone drug plan or a Medicare Advantage plan. Again, please look for that annual notice of change so that you are not shocked come January 1st that your drug plan went from being $17 to $58 or something like that, or even worse. All right, I do want to talk about star ratings just briefly. Medicare has outside companies that they hire to put together all of these star ratings that are based on many different metrics, but some of it is how happy you are with the plan that you have, and your satisfaction, utilization of the plan and the benefits that are offered in the plan, and all of those types of things. On a drug plan, it will have 1-star rating because it's just a drug plan. For the Medicare Advantage plans, you will actually see three different star ratings. They will have an overall star rating for the whole plan. It will have a medical coverage star rating, and it will have a drug plan star rating. The important thing to know about the star ratings is that the highest star rating that a plan can have is 5. 3 is still a good rating, a very good rating for most plans. 4 and 5, of course, are better. If it is a 5-star plan, that means that they you can enroll in that plan anytime throughout the year. It doesn't even have to be an enrollment period, or you don't even have to have a special enrollment plan if it is a 5-star plan. The other important thing about star ratings, and this might be even the more important side, is if the star rating is below 3. If it is a 2.5 or lower star rating for more than 2 years consecutively, Medicare will not renew that company's plan. So the star ratings are there in part to protect you from getting enrolled in a low performing plan that may go out of business partway through the year. So that is an important feature to look at, and I do suggest that you pay attention to that. These are just a few pictures of my family. In the top middle is my husband's stepdaughter and her boyfriend. On the side are my 2 doggies, being cute, curled up in the same crate. They don't usually do that, but anyway.
Horrible. Being a lot cuter than my dog at the moment. Yapping at the door to be let in.
Yeah, that was one of those rare moments, I don't remember when, early in the morning or something, where they're both still being lazy bums. And then down on the bottom right or left, actually, is a picture from a couple years ago, family back east visiting, my sister and brother-in-law on the end, my mom there between my sister and my husband, and then on the other end is one of my aunts.
So awesome
just
to have your
good family rememberies, making up words here. Memories.
It's early in the morning. We're recording this, by the way.
Yeah. And again, you can use that QR code to reach out to me, or that is my direct phone number on the bottom of the screen as well. Okay, let's talk a little bit about Medicare supplement insurance. As I mentioned previously, this is more like a traditional insurance plan. With the Medicare supplement, it will supplement, or they also call it Medigap, fill in the gaps of what original Medicare doesn't pay for. So all of the benefits that we looked at in those 2 screens previously under Medicare Part A and B, as I said, about 80% of that is covered by Medicare. If you have, an inpatient hospital stay, they'll cover about 80%. But then you would be responsible for the other 20%. The Medicare supplement comes in and fills in the deductibles, copays, or coinsurances that you would normally be responsible for and pays a portion of that. In some cases, that is 100% of that 20%. In some cases, it is a lower amount of that 20%, depending on which Medicare supplement you choose. They cannot be used with a Medicare Advantage plan. So you cannot have a Medicare Advantage plan and then get a Medicare supplement plan thinking that the Medicare supplement will pay your copays. That doesn't work. Sorry. There are 8 of these plans that are standardized nationwide. They are designated by a letter, which I will show you next. There are 3 states, of course, that have their own versions of the Medicare supplements. Those are Massachusetts, Minnesota, and Wisconsin. But otherwise, in the rest of the 47 states, they will have the plans that I'm going to show you on the next screen. And it's important for you to know as a consumer that when you are enrolling in Medicare for the first time, within the first 6 months of your Part B becoming effective, you are guaranteed issue into a Medicare supplement plan, regardless of your current health condition or previous health conditions. For instance, if you've had cancer in the past, or if you currently have diabetes, they are not going to look at that. They are just going to say, yep, you're accepted. All right, so here is a graph of the plans. The plans that are in the dark gray on the left side of the screen are the 8 that are available nationwide to everybody currently. So when you're looking at these plans, and I'm going to talk specifically about Plan G because it is currently the most comprehensive Medicare supplement plan available. The Plan G will be available from multiple carriers in your area. Many of the companies that I like to work with the Medicare supplements include Humana, Blue Shield, United Healthcare, Anthem. There are others, but those are kind of the most common companies that I work with currently for our area. But what you'll notice is that the Plan G benefits will be the same for each of those carriers, hence the standardized. They're standardized plans. So the benefits of a Plan G will be the same. However, the premiums that are offered by those companies may differ. So looking at the different companies to compare premium is to your advantage. The other thing I wanted to mention about that, some of the plans will have additional value add benefits that they either provide at no charge, or they may have like the dental, vision, hearing that people want so much that you can add as an additional premium, but that will cost additional in most cases. For people who did qualify for Medicare prior to January 1st of 2020, you do still have the plans C and F available to you. However, in most cases, I don't recommend them because they are so much more expensive than getting a Plan G, for instance. And one person that I work with describes it this way. On a Plan F, you pay a much higher premium to get a $240 discount. Because the only difference between Plan F and Plan G is that you are responsible for a one-time annual deductible, which is currently $240. Again, for 2025, I do expect that will increase. Approximately $20 is my estimate, but I don't know the exact number yet. But you're basically paying $500 or $600 more a year to save $240 usually on a Plan F. So it's not worth it necessarily to keep that Plan F that you love so much, but we can talk about that. All right. I'm going to kind of start to wrap this up now, but I want to just make sure that I remind you how this process works when you're starting your Medicare enrollment. For everybody, the first thing you need to do is get your original Medicare, which is the portion the federal government provides, in place. That includes both your Medicare Part A and Part B. And that happens when you're turning 65, or if you have delayed benefits because you were working and had employer coverage, then you get a special enrollment period based on your retirement or loss of employer benefits to be able to enroll in your original Medicare. Once you have your original Medicare in place, then you have the option to either getting a Medicare supplement and prescription drug plan to help cover that 20% that is not covered, or you can look at the Medicare Advantage plans, depending on your needs, to see which option is going to be the right option for your needs and budget. I will say one thing. In order to satisfy Medicare, the only additional coverage you need is a prescription drug plan. So if you have Medicare A and B, and you're okay paying that 20% that they don't cover, as long as you have a prescription drug plan, Medicare is satisfied that you are fully covered and you will not have any penalties. Most people don't want just prescription drug coverage, but that is an option. So just wanted to throw that out there. For people who may have additional or have Medi-Cal or get extra health benefits, they may have some additional options available to them. This is generally applicable for people of lower income who may be struggling financially. Extra help is specifically it's a national program, a federal program that helps specifically with reducing drug costs and premiums. Medi-Cal is our state version of Medicaid, which of course is available nationwide. But if you did have either of those benefits, there could be some specific options available to you as well. Okay, come on. All right. So just to reiterate, I am here to help you navigate this very confusing system at no charge. It does not affect any premiums that you would pay moving forward. The way I get paid, since I know that's a question, is through compensation commissions directly from the insurance carriers that I represent. When I enroll you, they pay me a set commission that Medicare designates for the year. So don't worry, I do get paid quite well to help you, even though you don't have to pay me anything. And I will help you.
Something important about that is that it's standardized across the plans. So Susan is not motivated to put you in one plan or another. There's no
Absolutely.
bias there. So it
Yes.
really is a good deal to work with her. You get lots of
Yes.
information and it actually doesn't cost you anything.
Yeah, and then the other thing that's really important about that is if you can go and self-enroll. Absolutely. You can do all of this all on your own if you want to. I don't suggest it because I think it's confusing enough that it's good to have somebody who is certified and knows what they're doing. But you could do that if you really wanted to. You can go on Medicare.gov and enroll directly. But if you do that, you are at the mercy of the 800 numbers for the carriers that you enroll with if you have a problem. If you have a problem and you enrolled through me, all you have to do is call me and I'm going to get you assistance to resolve those problems and direct you as to where we can look and go moving forward if we need to make changes. And then also I'm going to help you look at, does that retiree or union benefit make more sense than going on to Medicare, whether that's Medicare supplement or Medicare Advantage? Because I know some of you do get the option of a retirement program. Sometimes those are fantastic, and sometimes I found they're much more costly than going on Medicare. So I would say, let's review that before you make the decision either way. And I believe, this is my other partnership that I have. So I do get very busy sometimes, and I also like to take a vacation every once in a
Oh, no
while. So
kidding.
I have a partnership with a company called Spark. And when I am not available, they will offer my clients assistance and support when they need it the most for these certain areas, with billing assistance, finding providers that are in their network, appointment scheduling, prescription drug assistance, whatever that may mean, and other assistance on just answering questions about their plan or benefits that may be available that they weren't clear on or sure how to take advantage of.
That's so helpful.
And this is all of my contact information. I am a licensed agent here in California, as well as Nevada, Florida, New York, and Maine currently. It's very likely that I will be adding licenses. Arizona is probably one that's coming soon. Idaho is another one that I've thought about,
Yeah, get
but
that one. We have some folks there. We'll be needing your help.
yeah, because in the last few years, there's been a lot of movement into Idaho, Arizona, and then Oregon is the other one that potentially I might add, but not so sure on that one yet.
Yeah.
But anyway, this is my contact information. The best number to call me on is my office number, but it does not work for text messages. So if for some reason you absolutely have to text me, please use my cell phone. You can also contact me by email. You can visit my website, www.susanplucas.com. And I do have this scheduling application that I use, which is also, you can access that on my website. But anyway, I thank you again, Angela, so much for allowing me to have this time with you and your clients this morning. I really appreciate it. I am going to close this now before we
Thank
go.
you so much for taking this time. You all don't know this who are listening, but she has a packed 12-hour day every day until December 7th. I mean, she's really busy. So thank you so much, Susan, for sharing this information. You make it clear and easy to understand, and I really appreciate you. And
Yeah.
if you have questions, please reach out to Susan. If you have other financial planning or IRMA tax related issues coming up around Medicare, I'm your girl for that. We'll talk about it and we'll make it work. Until next time, thanks for joining us. Take
All
care.
right. Thank you.